Well, this is definitely one of my most awaited conferences. I am very moved and happy to be welcoming Aline Anthony-Gerroldt or Gerald. I always have a slight doubt about the pronunciation of her name, but we can say that both on professional and a friendly account, because we have known each other on friendly terms, definitely can be admitted, I think. And you can see her appearing on camera. She's all pretty and well matched. I think her Instagram accounts, which was definitely one of my favorite ones, display the kind of crazy and inspiring enthusiasm that we need to surf on in order to discuss into details the pros and cons, basically, and the advantages of this froggy device. And to quote her, the tongue is a princess whose palace is our palate, and she'll tell us all about it in a greater details with even more maestro. I'm sure I wouldn't like to make her blush more than necessary, otherwise she might oversaturate the color matching code of her beautiful red color. Thank you. Thank you very much. Hello, everybody. Thank you so much, William. I will try to get my act together and collect my spirits after this grandiose introduction. So I am indeed extremely honored and flattered to be joining you today, and I would like to start by thanking the whole team of FroggyMouth, of course, for the organization of this e-congress, which is, after all, in itself a monstrous organization involving interpreters from several parts of the world and different languages, all regrouping around this precious and laudable subject for FroggyMouth, and I'm very happy to be presenting and introducing to you the daily use of FroggyMouth by a physiotherapist in its daily routine. I am indeed a masseur as well as physiotherapist in the region of Dijon. For those of you who know their French geography a little bit, it's in the vicinity of the Swiss border. And it's been a few years now that I've decided to specialize exclusively in patients who have maxillofacial disorders. It is a professional vocation of mine, and I will try to share with you the type of care I provide in my personal practice for adults as well as children, among others, by resorting to FroggyMouth. So how did I discover it? Well, by sheer random luck, I would say. I do work in close contact with ENT specialists, and Clémence Barrière is an ENT specialist with whom I work a lot, and she was the first one to mention this French device called FroggyMouth, whom I wasn't familiar with at all, and I attended one of the introductory seminars in order to better understand how it worked, and then I was fortunate enough to use it on myself to begin with, and then to get to know Guillaume directly, with whom a quite deep friendship was initiated from that moment on, because we happened to share a lot of values as well as views and perspectives. So now I can go as far as saying that I use FroggyMouth on a nearly weekly basis in my own practice. And of course, doesn't mean that FroggyMouth is a miracle remedy for as much that you could just prescribe and then in 3 months' time the re-education is all done and over with. Of course not. The child must be able to integrate all of these parameters and notions. The family should also collaborate to it. So the care really involves a very personalized service provided to the child and his family and immediate environment. So this maxillofacial re-education by a kine or physiotherapist, in fact, involves a great number of different spheres, some neurological as well as psychological ones, as well as oncological dimensions. A number of ENT cancers involve those problems that we can intervene on. And we know also how much sleep troubles are causing a lot of damage to our social security system, and this is one of the reasons why these maxillofacial treatment can be so important. Everything concerning also the former dyspraxias, OSAS, and also temporomandibular joint dysfunctions, covering, of course, the different functions such as swallowing, chewing, ventilation, and phonation as well, that you've heard a lot about already. So that's to give you just a better a flying helicopter view of the different panel and array of dysfunctions that the physiotherapist can look after. Basically, we know now that the orthophonist can also work on some of these ENT problems, but you should know that the physiotherapists have also in the meantime benefited from a number of competence and skills decrees, enabling them to treat all of these pathologies. And so it's really important to train yourself and inform yourself about the list of pathologies that you should be dealing with and put them in the broader picture. Because, of course, when you try as a physiotherapist to solve or heal a shoulder blade or a part of the whole body structure, basically, it's not just the separate part that you're going to have to be treating, but the whole patient, of course. So that's what I'm going to try and purpose to present to you now. In the context of this comprehensive and personalized care, it is clear now that any patient needs to be approaching this holistic approach. And this will involve a lot of therapeutic involvement by the family or the parents. Unfortunately, more and more families are separated or parents divorced. Therefore, you should make allowance for this family context, of course. And when choosing to adopt a FroggyMouth or a number of physiotherapeutic exercises for this child, it will, of course, matter to co-involve both parents. And all too often in my practice, I notice that depending on the parents' weeks or shared custody, one parent is more or less involved and informed about the actual re-education process and the exercises. And so it's, of course, hampering slightly the overall smooth evolution of this treatment, having to basically remind one parent about the other parent's involvement and so on. So we really need to make them understand right from the outset that both of them need to embark on this learning process, whether it's a 3-year-old child who's already understood that he needs to put his froggy, or he's even collaborating, at least in terms of acceptance of this device, will not spontaneously, of course, have the discipline to think of the rhythm or the regular pace at which he should go along with the exercises. So all of this is really important for the evolution, the growth of the maxillofacial muscles and structure of their child. And we really need to make them aware as soon as possible about the forging elements, basically, of their therapy for their child's future. So, as I said, the therapeutic implication of the patients and their parents sometimes need a little encouragement, these little stimulus to help them go forward depending on the situations need to be tested sometimes on yourself. I was fortunate enough to test the FroggyMouth on myself, and I realized how promising the results could be in relationship, of course, with a more comprehensive set of exercises in this re-education program, of course, depending on and based on the discussion you've had with your patient or his family. And all of this was monitored on the side and at the same time as my own re-education. So that was enabling me to really stay in touch with the family-dependent context and made me aware of how important it was to see how mature the child was, whether he understood part of the motivation or the reason why he was brought there. So the first question I ask him when he's taken by his parents to see me is, do you know why you're here? Because a child who doesn't know why or what he's doing, basically, will be less involved and therefore less efficient in his participation. Because the acquisition of new functions and of a new behavior cannot be done overnight, obviously. Otherwise, if it could be done by the touch of a magic wand, it would already be known. And so that is why when I resort to the FroggyMouth, I always specify from the very beginning that you'll have to understand all the side effects as well and side prerequisite to make it work. Now, because every patient is different, every smile is different, and every family context is different. You're not re-educating just a mouth, but a whole person, the smile and his emotions and everything that goes with it, basically. So it really should be sold in that sort of realistic way rather than presenting it as a miracle solution. And that is why I always explain both to parents and children that implementing a froggy mouth therapy is like learning to brush your teeth in the morning. It's something that will have to be integrated into your daily routine and will matter and will structure your growth around it. So what I try to make the children understand to begin with is, okay, your dad and mom are going to buy this device. So they're making a financial effort for you. And therefore, there is a counterpart or an obligation on your side, on your part as well, to make your utter most in order to make it work, basically. So it's like a contract in a way, or at least a pact between the child and his parents, and that normally also helps him to become more responsible, of course, and empower him basically with part of the decision process. So normally that is part of the successful factors of the therapy, because if you achieve that goal of making the child an actor of his own destiny, it's basically an extremely positive pedagogical element for the success both of this therapy and of the child's personality. So I have a great number of children coming to my practice who daren't smile. In fact, they can have a lot of complex at that age because their teeth aren't perfect or as well aligned as they would hope to. So what I explain to these children is that basically we're going to be working on your dental alignment in order to help you smile with beautiful teeth and smile to one another more often. So I kind of play a lot with this emotional registry because we know how sensitive kids can be to comparison and to derision as well among their peers. So a child who doesn't sort of spontaneously smile, in my opinion, although it is quite common, is not normal. So we really should strive to make sure that he can smile completely uninhibitedly and eat without the slightest problem. So now, concretely, how does it work with FroggyMouth? Well, I opted for prior orders of FroggyMouth and then sell them to the parents further. Why? Because in the beginning I gave them a choice. I said, okay, I've got a few samples here, but you can either buy it from me or buy it directly. A lot of parents, in fact, who are overwhelmed by their obviously professional extracurricular activities and school homeworks and so on, come back to me saying, okay, sorry, we just only acquired it the day before yesterday, or oh, I'm sorry, I forgot to buy it. I was going to order it on the internet or something. So basically, I've now decided against that sort of alternative, and I'm not giving them the choice anymore. I'm buying it on their behalf, telling them why I favor that approach therapy and why I believe it is useful. I can then advise them from a hygiene point of view as well as from a practical point of view. And the child really can appropriate himself this device straight away, understand what a precious device and object it is going to be for him, and is considered or dubbed big enough to look after it himself. Of course, explain on the side way to the parents exactly how to be taking care of it properly, not to letting it too close to the dog's bites or to throw it by mistake in the waste bin or down the drain, basically, but as much as possible involve the child directly, put himself in front of the mirror when handing him over the device for the first time, and look at himself in the mirror. Actually look at themselves in the mirror even without the Froggy device to start with. And that's a really super surprise effect because it's like a special effect on camera, basically. And they realize suddenly how their tongue or how their mouth is going to be conditioned by this device. And that is also how the parents start realizing also what aesthetic as well as functional implication the FroggyMouth device is going to be having on their life. So it really matters for me that all of this can be monitored closely enough, and therefore that's the reason why I've decided to sell it directly in my practice and hand it directly to the child by saying, okay, this is not going to be your own personal FroggyMouth with your little carrying box, and you can even tune it if you like, put some little stickers on and call it a certain one way or another, say call it your potato mouth or your Mr. Froggy device, etc. So now I'm going to study a clinical case of a child which has moved me very deeply. She was recommended to me by a pneumologist. I'm based in Dijon, so as you know, there's not that much sun. She arrived with a really pale complexion. She looked so dimmed out, basically, was extremely introvert, was still having urinary incidents at night, obviously had some behavioral disorders, couldn't concentrate or focus very well at school or during our first interview. So the first time, as I said, she definitely struck me as being particularly an abnormally introverted. And then when we started the re-education, we decided to talk and talk with her mother as well as with herself. And gradually throughout our sessions, look at the transformation and how on the right hand side you can see this little girl smiling and opening up. And in fact, parents, of course, don't always notice the difference straight away because they're there on a daily basis, of course. But when I did this before and after sort of study and small survey, the mum burst in tears herself because she realized suddenly how much her child and daughter was feeling better, had gained in terms of self-esteem and confidence and sociability. She had acquired a lot of trust base, which is, in my opinion, probably part of the most important and fundamental success factors, basically. So for any kind of orthodontic treatment, working in collaboration with a pneumologist who had been sending her over to me, and then with the parents and making sure that we can take care of establishing solid basis for their future is really what is so gratifying about this profession. Now, another clinical case I wanted to show you comes from an adult who had been sent to me after his ENT cancer, following which part of his mandibule had been removed, and the chemotherapy had greatly affected, as you can see. The first time I met this patient, you can see how he looked like on the left-hand side here, a very dry tongue, a mouth that was all paper shriveled, basically, and he was breathing exclusively through the mouth, but having a lot of swallowing and mastication problems. So we worked a lot on the mobility, as much of the cervical spine as of part of the maxillofacial muscles. And the patient was extremely collaborative. What he was aiming at was to be able to eat a little better, enjoy a coffee perhaps once in a while. He wanted to reconnect to part of his hedonistic lifestyle, so to speak. We know how French care about gastronomy, and so that was a great part of his distress. He was very diligent in wearing this FroggyMouth in front of TV on a daily basis, and he managed to recover a much better occlusion, as well as breathing through the nose again. Of course, some of the nose and ENT region cleansing practices had been prescribed to him, and he is delighted by the result because his tongue mobility increased, and part of his social rehabilitation was accomplished. So both of these cases show how you can improve a patient's lifestyle, and he was in fact able to enjoy a coffee on a terrace with his son after his physiology treatment was completed. Of course, his swallowing process will never be as perfect as before, but nevertheless, just a drip or a drop of pleasure recovered after that kind of treatment is in itself an achievement that we can praise ourselves for. So that was just to give you an overall broad view of what physiotherapists can do. And I'd like to conclude by saying that smile is what describes all of us. So a smile who is not smiling is really a red alert that you should take into account and hopefully try to overturn. So maxillofacial is for life, for great and small, all lifelong. And that was all. I am open to any question you would like to ask from now. And thank you so much, Aline, for this conference and for these interesting clinical cases, because for us, who indeed are part of a typically partly gastronomical and partly hedonistic culture, part of our efforts and research, of course, statistics and functionality comes into the equation, but it is also so important to impact people's lives at the end of the day rather than minding statistics. What sort of feeling you can create or generate in the patient's immediate surrounding or in his heart. And the two examples or clinical cases you gave us are extremely good ones to illustrate basically how much the medical as well as physiotherapeutical professions have a lot more to do with the human factor basically than with studies, results, or maths and stats, strictly speaking. There was a lot of interesting emoticons and emotional reactions in the chat, actually, following your presentation to congratulate you on your conference as well as on your results and your approach, especially bouncing back on your concluding philosophical motto. And to conclude, there remains only for me to encourage you to go and visit Aline's Instagram, because that will give you an even more in-depth view of how much energy she can deploy for her patients' well-being. So it's definitely worth visiting her Instagram account to see and discover, among others, who Maurice is, to instill a little suspense, basically. Now, a question here I would like to put to you that comes from the chat is, do you think that 15 minutes of FroggyMouth per day is enough? Well, based on some case studies, 15 minutes is clearly enough. Now, of course, as was the case for Clémence, every child is different, and you can have some adaptation phase in the beginning, especially for an autistic patient of mine who had some oral concerns and troubles. Keeping the froggy mouth in his mouth, so this external body for as long as 15 minutes was too much on him to begin with. So in his case, we had to start progressively and then reach the 15-minute threshold. But for other parents, on the contrary, 15 minutes appear as close as nothing. And so when I try to explain to those hyper-dynamic children how many minutes there are altogether in the day, they suddenly realize that it's not that much of an investment, and I can motivate them gradually to go beyond that threshold. But what I explained to the parents, because of course I can also sometimes understand people's reactions when I say, okay, 15 minutes sitting in front of the TV is a bit of a biased suggestion, and some parents are against TV or screens in their family. So I'm telling them, of course, that it doesn't matter. You can do it in front of a book as well, but what would be the best position? Because you need to be nevertheless in a relaxed attitude. You need to make sure that the children are positioned so as to maximize their proprioceptive qualities. And sometimes they can even stay in the practice. They bring their little container or box of FroggyMouth and explain me what their preferred attitude or position is. And then they explain how and discuss or enter into a dialogue with their own parent about what a smile can look like, how the lips position themselves when you want to put up a happy face, basically. And then they can do this while drawing or while reading. And basically, in this quote that you gave in your introductory speech about the fact that the tongue is a princess whose palace is the palate. Sorry, well, I'm not, I think, the first total original inventor of that motto, but I definitely found it quite telling. And another important aspect, and perhaps one that I commented on or added myself, is that you shouldn't forget there can be some bats in the attic of a pallet or of a palace as well, and you want to get rid of those and make sure you can at least organize them in a sensible way. Well, thank you. I don't know at the end of the day whether you're the inventor of that proverb or not, but I believe it's extremely important to tell everyone how much the time and energy you dedicate to your patients in order to make sure that they can invest themselves in their own rehabilitation and re-education process, balancing out the passive and active factor, I would say, of their responsibilization is what accounts for part of the success of your results, because you may have sophisticated devices. You will, if you're not sufficiently motivated and stimulated, well, you won't probably reap the fruits of your efforts. So this is definitely what should be remembered, I think, and what comes across after your presentation. A lot of people have asked us for the link to your Instagram account, and you'll find it in the comment or the chat. For anyone interested, there is also a lot of congratulations, a lot more congratulations and questions seem to be flowing in. And we shall probably continue with the questions and answers session on the specially dedicated location for that of our Congress page. On this Facebook group as well, you'll be able to react to Aline's presentation, and she will endeavor to reply to all of you in the best possible delays. As you know, these conferences will be available in replay or podcast mode on our platform for 3 months. So if you're watching us in podcast already, go straight to the Facebook group in order to ask more real-time questions or perhaps read about other people's questions. And don't hesitate to send Aline some feedback about the evolution of your own therapies or treatments. So it's a real pleasure to listen to your shared experience, and we look forward to the next revolutions you'll communicate to us later on. Thank you. It's always with great pleasure. And to conclude, you can also use another metaphor. Basically, it's like the wheels in a bicycle. You need to have smaller wheels to find your balance and to learn to ride a bicycle. Well, the Froggy is a little bit like those small side wheels that you can remove after a short while, but that definitely helps you find back your own access. Well, thank you. That definitely seems to be a spontaneous quotation of yours that we can add to the long list of the previously mentioned ones, whether they were authentic or not. Thank you so much. And again, you looked grand.